In 2007, the Federal Capital Territory and the 36 states of the Federation were invited to apply for conditional grants for the execution of projects targeted towards achieving the Millennium Development Goals, MDGs, using funds saved from the debt relief gains. The key sectors covered under the first application were health, sanitation, and water supply. The FCT MDGs office came up with a strategic intervention in the provision of potable water supply in 4 categories: boreholes and 4-compartment toilets for primary school and GSS to take care of hygiene, community boreholes to serve communities of about 5,000 people, mini water schemes, for example in Rubochi and Munu, to serve large villages and towns, comprehensive water schemes, for example in Abaji, to serve large towns and network of other nearby villages in the environs.
If you are talking about health, you must get good drinking water. It is our belief that to get the diseases out of hand, you have to mitigate them from the area of their source. I know that most of the diseases come from waterborne diseases, and therefore we approach it through this angle. We did this having studied the community in liaison with the area council. This place is Abuja Municipal Area Council, and the community is Kabusa. We liaised with them, and they told us this is a place of want. They lack good drinking water here. And from our studies, we find that the community is up to 5,000. In fact, they tell us they're up to 7,000, including the settlers with them. So we're able to get them this one project. This project consists of a solar borehole, solar panels, and it is water is being carried by a 20 cubic meter tank. Now the water pumps, they are using solar panels, and then it is distributed through about 15 points here. One of these points you are seeing here is this type we have up to 15, so that they can serve the various communities. We try to avoid people gathering here as a large group, and that is why we have given such spots, so that we reduce the number of people gathering at a spot, and hence cutting the fight as much as possible.
Precious Eze is a 25-year-old mother of 2. Although she just moved into this community a couple of months ago, Precious is already a beneficiary of the water scheme here.
I thank God for this water. This water, they help us. As this water come here, with the fresh water well. No go buy water again. Before they say water one for 20 naira, but this one are free with the fresh. So we dey thank God for this water. This water they help us well. Anything that you want to go do and well.
In the MDG program, we have done this project starting from 2007, 8, 9, and 2010 we are scaling the FCT. Within this period, we are spreading over the 6 area councils: Abaji, Municipal, Buhari, Gwagwalada, Kuje, and Kwali. All of them, we have produced all these type of schemes into indigent communities. And the total we have had, is close to about 388. We are in the areas of toilets, primary school water, also 422. Total community water scheme is still about 188. And then we are also venturing into the area of primary health care schemes, which we are constructing. And in the 2010, there was a cholera attack, and the Honorable Minister FCT has graciously allowed us to intervene. And we intervened by providing this type of boreholes in those 30 communities that were affected. We're also giving a cluster of communities within such affected areas primary health care schemes, about 3 for each area council.
The Pasali scheme is a typical community scheme that we do, that I've said we have done in more than 168 communities. And that at least we reticulate them in 4 or 5 places within the community. And then we leave the ownership of this scheme back to the community. and they drive their own strategies of giving the water and the timings that they give the water. And since it is driven by the solar, it is a little bit less costly in terms of operations and maintenance. And so this has been an interesting initiative that we have been able to achieve.
Angwan Pasali has been in existence for more than 300 years with a population of over 7,000 people. Here is a 115-year-old man who testified to that. He is the father of Zinwondo Chewaje. Zinwondo is a community leader. He is over 80 years old now, has 3 wives and 16 children. He is happy his people no longer need to get water from streams.
Come on.
He said they are very happy with coming of this borehole here. Before they used to go to stream and fetch water, but as this one come, they are using it to bath and drink. They are very happy.
I'm Diko Shiwodo from Pasari, Kabusa in Amak. We thank God with the MDGs project at Agwan Pasari here. As before, we do fetch water from the stream. When Kabusa become rampant, or when population fill into Kabusa, the water became polluted. So with the assistance from the MDGs, we are now drinking water from the borehole freely. As you can see, our women are fetching water without any embarrassment, without any suffering. So we thank God with the MDGs project. We need more of MDGs projects like primary health care, electricity. As we can see, we don't have primary health care. We don't have electricity. So we need MDGs to help us with electricity and health care in Kabusa here or in Angwan Pasali here. We thank God for MDGs project.
Basically, today, there's community water schemes in over 168 communities. In fact, in 2010, 30 additions. Boreholes have been provided by the Honorable Minister, Senator Bala Mohammed, to address the issues of waterborne diseases, cholera, and the rest. So these communities were chosen, particularly in Abaja and Kuje, where we had the initial cholera epidemic in 2010. So today in FCT, more and more communities have opportunities to have water. And the other side, that is the primary school side, we were able to accomplish in 2009 the provision of this water in all 460 schools, public primary schools that were available in FCT. So this exactly means that as we move in some communities, it is the school borehole that is serving the whole community, particularly when the community is less than 500 community. So we're trying to be sure that by the end of 2012, all communities with a population of 1,000 in FCT have potable drinking water through a community borehole scheme. And even those that are below that, where there are established primary schools, they will have the opportunity to use the primary school water.
Yes, you are at another point now where water is also coming. But I must quickly say that we have a lot of challenges in this scheme. The first challenge is, first of all, in the area of accessibility of our communities. We are lucky this area is easily accessible, but then it is not without its own problems. You can see at the last point you left, you notice that the fetching point was sandwiched near a building. The problem in some areas we have been rejected sites. The people will say no, they will not give you this site, we want to build here. And this is as a result of haphazard buildings. So we are trying in this aspect to see that we sensitize the community to let them understand that if on water projects, you first of all have to do a geophysical survey. And it is that survey that will tell you where you will get the water. So we don't just go and drill water anywhere. So we are also asking even the government to come in the areas of accessibility to the areas to see that we get accessible roads. We have many areas where we have awarded contracts to go and drill the borehole, but we will not be able to access the area, especially with the drilling machines. So that has been our problem. We are calling on government, both local and state governments, to make sure that they make all these villages accessible. Two, the other area we have problem with or challenges is vandalization. Most of a good number of our projects are being vandalized, either by thieves. They take away the pumps, they take away the solar panels, and we've been able to mitigate it in a number of ways. One, we have branded our pumps and our panels so as to deter people that are stealing them away from us. So that is the area we are mitigating that challenge of vandalization. The other one is ownership. Well, as I told you, we have involved a program we call DRA, Demand Responsive Approach, whereby people, the communities will own the projects themselves, let them see it as their own, and that will help us from vandalization. And these are the areas we are approaching it. We'll be launching the DRA this year on full force, and the people will be encouraged to own their project and then be able to protect it against vandalization, against armed robbery, against thieves, and others like that.